And Gary,
Yes, ma'am.
I think we can ask for the slide when it's best to put it up so it's not up the whole time because we don't need the one slide for the whole question.
Okay.
Okay, now I'm in the middle. Chris, you disappeared into the Kaiser Permanente. We can't hear you. You're on mute.
I was playing with my lighting and doing my magic tricks.
I have natural light coming in.
That's good. I think the other day my lighting's better because it was later and the sun was on the back of the building. So now it's kind of dark, even though my window's open.
Are you in the office?
Yes.
No, there goes that red chair again.
All right. Well, good morning, everyone. We're going to get started with the webinar we have planned for today. And this is flu in the era of COVID. And we'd like to tell you, I'm Gary Sparrow. I'm the membership director here at the Henry County Chamber of Commerce. And I'd just like to welcome you to this. I do want to mention a couple things we have coming up at the Chamber. On this coming Monday, we have our next Community Dialogue book club, and that will be a very informative discussion. So make sure and register for that if you haven't yet. And then also next Friday on October 30th, we have our annual member appreciation lunch. That will be an outdoor event here at the Chamber. so we can kind of keep everyone socially distanced. So a fun event. We have a costume contest, kind of a Halloween theme. So we encourage everyone to come to that. That's able to wear your best costume, because we'll have some prizes for the costume contest. So that's kind of some things coming up at the chamber. Again, thank you for joining us today. I would like to introduce our panel this morning. We have from Kaiser Permanente, we have Dr. Belkis Pimentel. We have Dr. Felipe Lobello and Dr. Marcus Chris Griffith. We appreciate y'all being on. And then also from Piedmont Henry Hospital, we have Dr. William Watkins, who's the Chief Medical Officer there at Piedmont Henry. So thank y'all for joining us this morning. Good to have you with us today. So we are going to get right into a presentation and some questions that we have about the flu and the COVID pandemic, and I think it'll be very informative for you. There is a Q&A feature in the webinar, so if you have any questions you would like answered, feel free to use that function. You can put those in the chat also, and those watching on Facebook Live, if you want to ask some questions there, we'll make sure and get to all the ones that we can. If we run out of time and don't have time for all the questions, we'll make sure and get those answered after the fact. This webinar will also be recorded and available to view afterwards on our resource page, togetherforhenry.com. So we'll get right into it right now. And so let me pull up our first slide. And we're going to go to Dr. Lobello. And Dr. Lobello, if you can tell us about the current state of COVID-19 in our community.
Sure. Thanks, Gary, and for the invitation for this event. We're glad to be able to share some of these data and some of these topics with you. Obviously, we are in the middle of a pandemic, the worst pandemic we've had in 100 years, and over the next 3 months, we need to really be careful to try to lower the transmission of COVID, because we know in the fall, respiratory viruses have an increased circulation. In this slide, you can see that for Henry County, the activity of COVID transmission remains high. The daily new cases, as you can see, is the number is 16, which is high, or an orange sort of level. We typically want to see this number as low as possible. When it's over 25, it's really a critical level, and we've seen an increase over the last few weeks. In fact, at Kaiser Permanente, we already consider ourselves to be on a surge of COVID-19, and we're bracing ourselves for what that's going to mean in terms of hospitalizations over the next 2 or 3 weeks. So this really underscores the importance of the 3 W's: wearing your face mask as often as possible, especially when you leave your house, washing your hands, and really avoiding crowds, avoiding congregations of people. The infection rate really tells us, is the pandemic expanding or shrinking in our area? And you can see any number over 1 means the pandemic is expanding. In other words, is growing. Transmission is growing. So it's another component of the numbers that we looked at when we want to get a picture of how much transmission there is going on. That number has been as low as 0.8. And we really want that number to be as low as possible, again, in order to lower the transmission of the virus. And we also have data showing that the percent of positive tests has been increasing in the last couple of weeks. It's still not at a critical level, but the combination of all these numbers really tells us that we are going up into a third surge of transmission, just similar to what we saw in the summer. And we are worried that it's going to be worse, again, because of colder temperatures. People are starting to congregate indoors. We have the holiday season coming up, and we know that household transmission is going to increase. And in fact, you probably have heard Dr. Fauci, the nation's most important infectious disease doctor, suggesting that maybe this year you need to be very careful and maybe not hold family events during Thanksgiving, for example. because transmission of the virus in household events, even small household events, is increased. So we just want you to be mindful of all these data and make the best decisions that you can to protect yourself and your family.
All right. Thank you for that. I do want to bring in Dr. Watkins at this time, and he's going to kind of give us where we're at with Piedmont Henry Hospital, which is our local hospital here, of course. So Dr. Watkins, let me turn it over to you.
Thank you very much. Are you currently seeing the screen?
Yes, sir.
So at Henry, this is what we've looked like for our COVID census starting. Our first case was March 10th, and we had our first wave. Our maximum number of COVID patients in the house at the same time was around 60. And then we tapered off in May, and things started opening back up. And we had our second wave, and we peaked out at 80 patients in the hospital at a time on a single day. And as you see, we've tapered off, but not as far back down towards normal as we did back in May. And we have recently seen a slight uptick, and that's consistent with the data Dr. Lobello just discussed with everyone. So we are preparing to enter our third wave, and we will see how that looks. And just to let you know about what we've been doing on a whole, we've actually treated 935 COVID positive patients, and that's 3% of the COVID patients in Georgia. We did have 82 deaths, and that's 1% of the COVID deaths in Georgia. So according to our DPH website, the Georgia hospitalized mortality rate's 25.1%, and we're running around 8.8 at Henry. Now, what's very important is that when you add flu to the mix, we're probably going to see an increase in this because there are going to be more comorbidities going together, which is going to make it more difficult for people to recover. So it's really important to have our community do the things that are going to mitigate the risk of having COVID and or flu. And we have actually treated and discharged 823 patients from Piedmont Henry. So we're continuing to take care of our community, and we want to spread the positive word to everyone.
All right. Thank you for that, Dr. Watkins. We appreciate what Henry is doing for us. So we're going to go back to our presentation, and next we're going to have Dr. Pimentel. Kind of give us a difference between COVID-19 and the flu, and should we be concerned about one more than another as we get into the flu season right now?
Yeah, so thank you so much for having us. It's an honor to be able to be here with such distinguished colleagues. Dr. Watkins kind of set up what I want to talk about with this flu and COVID that we like to call twindemic. All right, so they are very similar. They're respiratory viruses that infect the respiratory tract. They also both are known when you have the illness to worsen underlying disease. And you can also transmit it when you're asymptomatic or before you have symptoms. And both in flu and COVID, you could still pass it around and have no symptoms. And the symptoms are very similar. So it gets a little bit confusing to know which one you have. So you have cough, you have fever, you have congestion. You also have some shortness of breath, but in COVID, it comes on earlier. And it doesn't always come on in flu. I would say most of the time you're not having shortness of breath unless you're having pneumonia. The other thing that's different also with the symptoms is that COVID has a loss of taste or smell. That's pretty unique for COVID. You don't notice that in flu. But the symptoms are so variable for COVID. You don't have people having the same thing. So it's going to be a challenge to know what you have. So it's better to get yourself protected, try to avoid getting either and getting your flu shot so you at least can eliminate one of those two viruses. But let me talk about the history of flu. You know, viruses have been around forever. They are going to be here before we were here and after we are gone. And pandemics are part of our history, just like earthquakes and hurricanes and tsunamis, just part of our human history. And in 1918, 1919, there was a novel flu and they called it the Spanish flu. And it actually killed 50 million to 100 million people worldwide. And that's a lot of people, right? And there have been other pandemics that have not been as severe, but we can have a very severe flu season. This is a virus to respect, just like COVID. And we really need to be careful and not dismissing flu like just having a cold. So we really need to protect ourselves. And just as recently as 2017-18, we had an estimated of 62,000 deaths. So these are viruses that really affect us that we really need to take the precautions in order to prevent getting either flu or COVID.
All right. Well, also, who would you recommend to receive the flu vaccine?
Yeah, so we follow the CDC guidelines and we recommend everyone 6 months and older, but especially the people who are high risk. So you have your babies, those less than 5-year-old, those who are over 65. You have your pregnant women. You have healthcare workers. You have people with chronic diseases like diabetes and heart disease, kidney disease. People with weakened immune system like HIV, active cancer. So, and people in nursing homes and long-term care facilities. So one thing that we don't think about is obesity. Obesity actually puts you at higher risk, especially when your BMI is greater than 40. So it's a lot of people, and we might as well all of us who are 6 months and older get the flu vaccine because we're probably fitting in one of those. And even if you're healthy, you want to make sure you get it so you're protecting those around you and those in your community.
All right. Okay, thank you. Dr. Lobello, you have some statistics concerning African Americans versus other citizens receiving the flu vaccine and why there's a disparity in that gap. You're muted, Dr. Lobello.
Good call. Thank you. This is very important, and we've known about these racial disparities in influenza vaccination for a number of years. And at Kaiser Permanente, we track those numbers and we do a lot of outreach like these events to try to lower those disparities because as you probably have heard, with both COVID as well as with influenza, we see a disproportionate burden of disease, infection, hospitalization, and even death among minorities, African American and Latino community. So it's important for everyone to vaccinate, and even more important for our minority communities to understand that this is a disease that can be severe, as Dr. Pimentel said. On average, in the US, around 50% of adults receive the flu vaccination every year. And we obviously want that number to be as high as possible, because when you vaccinate yourself, you're not only protecting against this virus, but you're also protecting your loved ones, your community, the people around you, what we call the golden ring of protection, or the population immunity makes the virus transmission much lower if a lot of people are protected and immunized. And remember that not everyone can receive the flu vaccination. Obviously, the CDC guidelines say anyone 6 months or older, But remember that there are a lot of folks that have a weakened immune systems, that may have cancer and they're undergoing treatment, or for other reasons that cannot receive the vaccine. And we can protect them, help protect them by receiving the flu vaccination. So around 50% of adults receive the vaccine, but we've known that vaccination rates among minorities are lower, particularly for African Americans. They're around 6 to 8% lower every year, which again leaves a much bigger group of the population vulnerable to the ill effects of severe flu. And one statistic that that we always like to use to underscore this is that about 80% of deaths in the pediatric setting that occur because of the flu, 80% of the children that unfortunately die because of flu complications were unfortunately kids that were not vaccinated. So you're not only protecting against infection with the flu virus, but you're also lowering the risk of severe outcomes because of flu. And that's why we really encourage everyone to receive the flu vaccination. It's safe, it's effective, it's not going to give you the flu. There's sort of like a lot of misconceptions, and we'll talk a little bit about those, but it's really critically important to receive the flu, especially this year when we have two viruses circulating.
All right, great. Dr. Watkins, let me ask you right quick, as far as Piedmont Henry goes, and you're muted, if you'll unmute. Do you see the same kind of disparity as far as those patients that are admitted to the hospital for COVID and the flu as well?
The disparity that we've seen clinically is that the African American population is more susceptible and has a worse outcome. Their case is more severe. And it's very important to get out to the community that this conception of the vaccine is bad, I don't need it, it's going to give me the flu. They need to know how much protection they will get from it. So it's chipping away at that misperception that something is wrong with the vaccine. And we haven't even started talking about vaccine for COVID. That's another mountain, but it's proven. They pick certain strains each year that we think we're going to see predominant in the community, and that's what's in the vaccine, but it's not going to make you ill, and it's not bad for you. You know, nothing in this world is 100%, and people have to realize that. Is it possible you can get something called Guillain-Barré from this? Yes, it's possible. It's extremely rare. But the risks are definitely outweighed by the benefits.
All right, great. So Dr. Griffith, this kind of goes along with that. Can you help us understand the apprehension regarding the flu vaccine, especially in relation to African Americans?
Gary, thank you for having us and welcoming us back to Henry County. So part of the answer to this problem is what we're doing here today. Building trust within the community from people that you know, people that you trust. When you receive PSAs from government agencies, many times people don't heed them. They think it is propaganda. So the thing about why African Americans often don't accept vaccines has some historical perspective. So the first thing it's important for us to do is to not label or vilify people of color as being ignorant or obstinate about why they don't receive the vaccine. We all have heard about Tuskegee, which was not that long ago. And so many people have perception that, you know, there was this thing going on with the government and they gave people syphilis, blah, blah, blah. Well, it wasn't that. It was this. It was sponsored by the National Institutes of Health in the United States Public Health Department. and they wanted to examine the long-term effects of syphilis. So they took these poor Black men who had syphilis and they thought they were getting treatment for it, where in terms they really weren't. They were getting a placebo. So even when penicillin became available, for 40 to 50 years, these men suffered the effects of syphilis under the so-called protective arm of the United States government. And so it was President Clinton and Dr. David Satcher who then made a public apology and said that this would not happen again. And it's not the only case. There have been multiple incidents over the course of time that were experiments and trials were done, so-called in the good of science and the good of public, where people of color, people who were in prison populations, weren't given consent and were subjected to radiation and exposure to chemicals and medication trials that caused harm. So it has been within the last 30 to 40 years that there's been a major overhaul in transparency, in ethics, so that these things can't be done. And so, you know, these experiments are likened to what was done in Nazi Germany in this country. So that is why there's this fear and apprehension. And Dr. Watkins just referenced the COVID trials. And it is for some of these same reasons that we cannot get enough minority participants to be involved with the COVID trial vaccine. So that's part of the reason why you know, minorities, particularly African Americans, are hesitant to receive these types of vaccines.
All right. Well, thank you for that perspective and the history behind it. That's really good. Dr. Pimentel, Dr. Watkins mentioned a couple of misconceptions. Some I've heard myself. Last year was the first year I ever got a flu vaccine because I had heard the same thing. It's going to make you sick. So what are some other misconceptions that we need to look past and when we talk about the flu vaccine?
Yeah, I'll give you a few. There are a lot of them. But the most common one is I either know somebody who the flu vaccine made them sick, or I had it the last time and it made me very sick. And there are a lot of reasons people may perceive that. The flu vaccine is something that actually takes 2 weeks to actually work and build up your immune system so that you can get protected for those particular strains in the vaccine. So in any time period in that 2 weeks that you get sick, that you encounter anybody, it won't be protective. It won't be protective of colds. There are a lot of other viruses during the winter. So you can get a cold, people think it's the flu. And there are a few symptoms that people may get or from the flu vaccine that most people don't get. You know, everybody like gets soreness of the arm, but you may be a little bit achy. You may have a little fever, little sniffles, nothing like the flu. And usually that happens a couple hours after the vaccine and it lasts no more than a day. Definitely worth it to be protected against getting flu illness and their complications. Like for example, if healthy people, if you get the flu, you actually have double the risk of getting a heart attack after the flu vaccine, after the flu illness. And if you have heart disease, you actually have a 6 times increased risk to get a heart attack. I mean, those are significant numbers, and the vaccine has proven to be effective in lowering those risks by 30%. Diabetics, you know, talking about why African Americans need to get the flu shot, they have higher rates of having chronic conditions. So diabetes actually gets worse when you get the flu. And the people who have diabetes are 3 times more likely to be hospitalized from flu. And they have increased risk of death. Or if you have asthma, can you imagine COPD or asthma that are respiratory already diseases, then you get a pneumonia from flu or a pneumonia from COVID, and God forbid, you should get both at the same time, or one right after the other, and you don't have time to recover. Can you imagine? That's just a recipe for disaster. So it really is something that is worth taking. It does not make you sick, as Dr. Watkins mentioned, and we need to dispel that myth because it doesn't have a live virus. It's not possible. The other one that people talk about is like healthy. Okay, I'm healthy. I never have had the actual flu, so I don't need it. But as Dr. Lobello had mentioned earlier, like when we get more people vaccinated, we protect our community, we protect our loved ones, we protect those who may not be able to get the vaccine who are very close to you, especially if you have a newborn. And pregnant women also, they think, oh, I can't get the vaccine because I'm pregnant. Actually, it is very protective to have the vaccine when you're pregnant because you're about 4 times more likely to be hospitalized when you're pregnant. And you can get it at any time during the pregnancy. And not only that, when you get it during pregnancy, you actually pass on those antibodies to your baby who actually cannot get the flu vaccine until they're 6 months old. So it's actually pretty protective. And you want to definitely protect your little babies.
Absolutely. All right. Well, that's great. So, Dr. Griffith, coming back to you, what practices do we need to employ to change a no to a yes for those that remain skeptical about the vaccine?
So the first thing is this, again, is sort of like we're doing now, increasing our understanding about what it is and what it isn't. And so as my colleagues just referenced is that, you still may get the flu from this. But if you do, it will be much less intense. So it's sort of like wearing a seatbelt. People are still killed in automobile accidents, even though they have a seatbelt on, but we are trying to decrease our risk of morbidity and mortality, decrease our risk of having a problem being in an accident. And so we have to make sure we're informed and understand the whole process. So in understanding the process, let's just look back in history again. If we go back to 1900, early 1900s, the life expectancy of an American was around 45 years old. And for an African American, it was less than that, it was about 40. And so people died from infectious diseases. They died from the flu. They died from tuberculosis, polio, diarrhea. If you look at our life expectancy today, it's almost 80. And we're not dying from those infectious diseases. We're dying from the things we know, heart attack, stroke, cancer. And in part, the reason why we're living so long is because of immunizations, our measles, mumps, rubella shots, our polio vaccines. So it is those reasons that we're living longer, the flu shot. So understanding history and understanding the difference from why we died then from why we died today can hopefully help people to understand why this is so important to do this at this point.
All right, great. Thank you so much. Dr. Lobello, when is the best time of year to receive the flu shot? And do the effects wear off if you get it early or late, or how does that work?
Yeah, the best time to get it is as early as possible during the fall. Why? Because as Dr. Pimentel mentioned, it takes a couple of weeks for the vaccine to generate that immune response that is going to protect you against the flu virus. So you don't want to wait too late until you actually hear in the news that there are increased cases of flu, because then you're going to be vulnerable and not protected until you get that vaccine, and a couple of weeks later until you get that immune response. It does wear off, and that's why we have to get a vaccination against the flu every year, because we don't get an immunity that goes beyond 6 to 9 months. And also because, as been mentioned before by Dr. Watkins, the virus strains, the types of virus that circulate change a little bit every year. So based on the types of virus that we're seeing are circulating in the Southern Hemisphere, for example, in New Zealand, in Chile, in Argentina, and Australia, then the CDC and the government picks which virus strains are going to be embedded in each year's vaccine and that you're hopefully going to be protected against. But those change every year. And if you took a vaccine last year, it may not protect you this year. First, because your immunity has waned, but most importantly, because the strains typically change every year. So, the bottom line is do it as early as possible. At Casa Permanente, we started early this year in September. And you want to do it as early as possible. October is a great time to get the vaccine. And you can do it via drive-through at Kaiser or in many Walgreens and CVS or hospitals. And you want to do it every year to be protected as much as possible.
All right. Thank you so much. Okay, we're going to go back to another slide. So let me pull this up right quick. And we're going to talk now, Dr. Griffiths. One of the areas that is kind of least spoken about when it comes to the pandemic is the mental and emotional toll it can have on the community. So if you could kind of speak to us about the psychological impact of COVID-19 and then the flu twindemic, as we're calling it, and how that's affecting the community.
Very good, thank you. So I don't think any of us need me as a psychiatrist to tell you that we are stressed. Everyone is stressed. And if it was just as simple as this virus, it would be easier to handle. But there are so many things going on right now within our lives and our world. So we think about COVID, for example. This is a novel and new virus. Our bodies have never been exposed to it. And as a result of that, there are dire consequences. So think about the fear that exists because of this disease. When has there ever been a disease that if you shake someone's hand or give your grandmother a hug, then a week later they're coughing, the next week they may be in the intensive care unit, and the following week they're dead? This is a bit much to handle. So when you put COVID, when you put issues related to social injustice, when you have people who are ill and dying and a loved one is unable to be with them and they die alone, it causes lots of stress. So during these times, there are certain things that we need to do as human beings, as social animals, to help ourselves. Reach out for help. Don't turn to the bottle to help yourself. So if you're using drugs, using alcohol, that is the thing that will make this problem worse. Fortunately, Henry County has a very good public mental health system with Henry County Counseling, McIntosh Trail. So if you do not have health insurance, you can call and you can be seen for little to no cost. If you're fortunate and you work for a company such as, Piedmont, Casa Permanente, we have employee assistance programs to help all our employees. We also have, Casa Permanente, our own behavioral health department, and all you have to do is call to make an appointment and someone will see you just like this virtually. But we have to make sure we do these things to take care of ourselves, to take care of our body, to take care of our minds. So do like that thing that your grandmother used to say, you're given lemons, make lemonade out of it. So how do you make lemonade out of this? Get in better shape. There are a lot of great parks in your communities, Cochran Park. You can go down to, Indian Springs, you can come up to Panola Mountain State Park. It's safe, it's protected, you have fresh air. And so getting in better shape helps your mind, it helps your emotions. And if you do contract one of these potentially fatal diseases, if you're in better shape, you have a better chance of making it through it. So get in better shape. Spend more time in prayer, in meditation, in talking to your friends in a safe way. So again, we're in the middle of a pandemic, and right now, a lot of people are letting up. That's why we see the infection rate going up. So think of yourself right now being in the eye of a hurricane, and there's a sense of calm. We know that the backside of that hurricane many times can be more dangerous than the front side of it. And the backside, what we're seeing is spikes in the cases of COVID, and then the impending flu epidemic, and you could have them both at once. So make sure you keep yourself safe. So love yourself by wearing your mask, washing your hands, keeping yourself apart, and getting the help you need with your emotional state.
All right, thank you so much. Dr. Watkins, let me come to you in this same kind of line, because I know personally some relatives and friends that have had family in the hospital, and not with COVID, but with other things, and they can't be with them. They can't stay with them. And I know that has an emotional effect on people that can't be with their loved ones when they think they need them. How does the hospital kind of help with that, handle that?
When COVID first sprung upon us, we did go to a level 4 visitation policy where we weren't allowing any visitors in unless there was an exception to like end of life issues. That is a big strain on everyone. It actually puts more strain on the hospital staff because when you have visitors staying, oftentimes the visitors assist with the little things that the patient needs. And so it all fell onto the hospital staff. We recognized that it was difficult, especially if you have a long stay. I mean, even if it's a short stay and you're used to having your loved one be with you, it's frightening to be in a hospital in a new environment with no one there. FaceTime is nice, but it doesn't replace someone's touch. So approximately 3 or 4 weeks ago, we relaxed that visitation policy. Everyone is entitled to have a visitor for the day. We're trying to still keep the numbers down, so you can't have 2 and 3 different people per day. But everyone's entitled to have a visitor unless you are COVID positive. The reason being, we don't want to spread and expose visitors to COVID. Everybody in the hospital that sees a COVID patient has a fit tested N95 mask that we're sure is protecting them. So we couldn't even supply an N95 to a visitor and be sure unless they were fit tested. So COVID patients are still on restriction from visitors, but we take steps to make sure that the family and the patient are informed of everything daily. And we do try to set up video links so that they can see each other. But the strain about being away from family, and especially if you get the phone call that your loved one has died and you weren't able to be there because of a restriction, that's very emotionally scarring and something that's not easily healed. So we've tried to be very compassionate to the community because we realize that it's important to have your loved one with you, even if it's outpatient surgery. You know, back when we had stopped all elective surgeries, when we started back up, we had restrictions on who could come, where they could stay. And we're trying to do this according to the science and according to the compassion that we need to have in healthcare.
All right, thank you so much. Dr. Pimentel, how about some other lifestyle changes that we should employ to stay well during this flu season on top of the pandemic?
Yeah, so some ways to actually optimize your immune system are the things we've been saying for decades is eat healthy. You want to have lots of fruits and vegetables every day so that you can get a variety of nutrients and antioxidants. You want to have a well-balanced, low-fat meals. And you want to lose weight when you are actually overweight. So we mentioned obesity is actually puts you at higher risk. You want to exercise on a regular basis, 30 minutes a day. Doesn't have to be you go to the gym. You actually just put on some sneakers and go outside and walk, of course, having social distancing, or do something inside of your house with some, there's so many available exercise programs today that are on the internet. The other thing is sleeping. Do not underestimate the value of sleep. You need 7 to 8 hours a day, because when you don't sleep well, your immune system goes down. You're not as optimized. If you have chronic conditions, you want to stay on top of your numbers. This is not the time to stop any of your medications. You want to make sure you're well stocked in case we do go back into a surge where it's people should not leave their houses, or if you get sick, you will have to be at home. You want to make sure that you have enough medicine. And you want to call your doctor, simply call your doctor if you have any questions or if you have any symptoms of COVID. At Kaiser, we're available. We have lots of telehealth and virtual visits opportunities in order to be able to just talk to the doctor without having to come in and get it going at risk if you have any questions.
All right, very good. Well, I think we have a video that we wanted to share. So let me get that pulled up.
Yes, thank you. Gary, I don't see anything. I don't see the video moving.
You don't see the video moving?
No, I think you have to share your internet page, your web page, because we're looking at the slides.
There's some special settings for video in Zoom on sharing.
Dr. Watkins is a Zoom expert.
Okay.
As you're trying to get that up, let me just make a couple of points for children, because children actually, for flu, different from COVID, healthy children are actually at risk for death. And the flu vaccine has shown that there's a 51% reduction of death in children who have any chronic disease. But it's even higher for healthy children, 65% reduction. And if you ever want to take a look at what the stories are for families who have lost children due to flu illness, you actually look up families fighting flu. You can just Google that and you will see lots of stories that will compel you to never miss a flu shot for your children. The other thing is people who are 65 and older are at very high risk. About 70 to 90% of deaths have been in people who are over 65, and 50 to 70% of hospitalizations. So it's really important, especially when you're 65 and over, especially if you have chronic conditions, to get your flu shot.
All right. Well, great. Thank you so much. Dr. Griffith, back to you. We've heard a lot of information today. What are the most important points that we should take away to stay safe? And let me pull up the last slide here.
Well, as we referenced, all of us have referenced and know, we are in very, very challenging times. And there are, a couple very deadly viruses out there circulating among us, okay? So first thing we got to do is, again, protect ourselves, protect our loved ones, protect our colleagues, protect our mothers, our brothers, our sisters, our husbands and wives. We got to protect ourselves. And how we do that is, number one, wear a mask. Wear a mask appropriately. So, I go in the grocery store and you see people with a mask on, but, they're walking around with the mask on like this. That's not doing anything. Put the mask on the right way. Wear a mask to protect others, okay? Wash your hands. And you can't wash your hands enough. And so one of the things to do in washing your hands, you know, soap and water, alcohol, but make sure you do it for long enough. Maybe you do it 20 to 30 seconds. And how you do that is put your favorite song in your head, sing that song, and wash your hands at that time in order to, you know, help to do some very, very preventive measures. Socially distance. Don't be all up on top of people. We know we want a hug. Give a virtual hug. If you have to touch someone, give an elbow bump. We got to keep ourselves apart. You know, we have to respect the laws of nature, because the laws of nature have been around for billions of years and they're unforgiving. We got to get in line with the laws of nature. Next thing do is get the flu shot. Please get the flu shot. And so we think about what the flu shot does. It helps reduce the risk. So the example I like to give about this is, you know, there's two guys on a boat and they're in the middle of a storm. One's got a life jacket on, the other doesn't, and they're both thrown overboard. Now it's possible that both of them take on water and drown. But the one that's got the life jacket on has the better chance. That's what this thing is like with the flu shot in COVID. The flu shot is the life jacket, because it's very possible you can be like that guy and those guys in the storm and come down with both of these things at the same time. And if you come down with both of these things at the same time, you don't have to be a doctor to know this probably ain't good. So do those 4 things. And finally, you know, make sure you vote, which we do as Americans. That is what makes us different than most of the countries throughout the history of the world. Vote. And you got to be healthy to vote. You got to be healthy when you go to vote. You don't want to spread disease and illness to those other people in the line and those poll workers. So those are some tips that we should do. And, you know, thank you for having us and allowing us to talk about these things.
Absolutely. Well, while we finish, I'm going to ask our audience if anybody does have any questions. Use that Q&A feature, and we'll be glad to answer those. Does anybody have any parting comments for us?
I have a point. So, you know, when COVID first came out, testing was difficult, and getting enough test kits to handle community was difficult. We actually are working on a test that will check for flu, A, B, RSV, and COVID at the same time, because just as it's confusing to lay people, the same symptoms, there's no magic wand that physicians have to say yay or nay. And of course, there's still asymptomatic people that are carrying the virus that can be spread. So it's also important to do those things that mitigate. And the mitigation is going to help with the COVID as well as the flu. So you're actually killing 2 birds with 1 stone.
All right, thank you. Somebody asked if we were going to show the video. For some reason, I couldn't get that to work, but we'll have the presentation online with the recording of this webinar, and it will be available there. So just check on that. It'll be up probably in a couple days and on our resource page. So feel free to check that out, and you'll be able to see the video there. Sorry that didn't work for me. I was thought I had it working. It was showing on my screen, but nobody else's apparently. Any other doctors, Dr. Lobello or Dr. Pimentel?
Yeah, another thing that I may want to add is that, you know, we are of course in the middle of a pandemic, but we're also in the middle of an infodemic, and it's a situation where there's a lot of misinformation being spread on social media. on just the regular comments that you hear from other people. There's a lot of politics involved, of course, and it's an unfortunate situation that has made our country's response to COVID worse compared to other countries. So my suggestion is to listen to the doctors and not the politicians. Listen to the scientists. Listen to the CDC. The best source of information for both COVID and flu can be found on the CDC's website. They may not be able to do a lot of press briefings like they used to for political reasons, but their website is the best resource you have in both Spanish and English for authoritative information. And it's important that you take care of yourself with the steps that we've been mentioning, but also being armed with good information, because information is going to allow you to make good decisions. It's going to empower you. So, just rise above the fray. There's a lot of things that are difficult for our country at the moment, but there's a lot of power in your own behaviors, in your own search for reliable information that can help you and your family get through this.
All right, thank you. Very good advice there. Dr. Pimentel, anything to finish this out?
Gary, thank you so much for having us. It's been such a pleasure. If there are any other questions that come, we are happy to answer. We want to get all this information out and get the facts, as Dr. Lobello said, that we want people to actually arm themselves with the right information.
All right, great. Well, thank y'all so much for being with us today and for the information you provided. I know it's a wealth of information we heard here today.
Gary?
So again, our hour's about up. So,
Gary?
Yes, sir. Dr. Watkins?
Can I just wanted to see if I could possibly share something. I'm not sure if it'll work.
Sure, absolutely.
Every year, I care for patients in the ICU who are incredibly sick, patients who have tubes down their throats, machines breathing for them, and they're desperately clinging to life, all because of an infection that's preventable, and that infection is the flu.
Early part of this year, I had decided not to receive the flu vaccine and ended up getting sick from the flu. I ended up in the hospital. Organs were failing, come to find out. And if it wasn't for the great doctors here at Kaiser Permanente, I wouldn't be here today.
I want to emphasize that the flu vaccine is the single most important thing that you can do to protect yourself during the flu season. But it's not just you we're trying to protect. We'd like to protect your children, your family, your grandparents, and all the loved ones that are in your life. So please get the flu vaccine.
Don't end up like me. Remember, get the flu shot, because I know I will.
It showed up right at the end. Thank you so much, Dr. Watkins.
That's the advantage of having an MIT grad in this group.
All right, Chris.
All right, thank y'all again so much. And again, if anybody has any questions, feel free to send those in to us and we'll get answers for you. Y'all have a great day. Thank you so much again.
Thank you.
Bye-bye.
Bye.